Thanks for attending this talk on how to manage pain naturally. My name is Dr. Julie Huang. I'm here to introduce Dr. Antonia Tsallas to you folks. We're really fortunate to have Dr. Tsallas here, naturopathic doctor, IT certified, and she has her master's in Pharmaceutical Sciences. She's here to share with us a little bit of her clinical knowledge around pain management and how she does so naturally. She works with a lot of folks with different conditions, and I'm just going to read out a bit of her bio so you can learn a bit more, but I'm very grateful that you're here.
Thank you.
Welcome, welcome. So, Dr. Antonia Tsallas is a licensed naturopathic doctor in Toronto and was first introduced to naturopathic medicine while in graduate school at UBC in Vancouver in British Columbia. During that time, Dr. Tsallas experienced a different way of life and one that promoted a balanced lifestyle of healthy eating, physical activity, social connections, and the great outdoors. And she personally learned a lot about herself and was able to gain the necessary tools to help manage stress, anxiety, and fatigue. So Dr. Tsallas holds a Master's of Science in Pharmaceutical Sciences from the University of British Columbia, and she's able to use her strong knowledge base in pharmaceuticals in her clinical practice. In 2016, Dr. Tsallas obtained her Doctor of Naturopathy degree from the Canadian College of Naturopathic Medicine here in Toronto, Canada. She also has a clinical focus in chronic pain conditions, including fibromyalgia, as a lot of folks here may have been drawn to the talk because of that. So fibromyalgia, chronic fatigue, rheumatoid arthritis, lupus, multiple sclerosis, and other conditions like migraines, depression, anxiety, and hormonal health issues, as well as digestive concerns. She draws from the evidence connecting inflammation, pain, gut health, and mental health, and connected to her clinical experience. Dr. Tsallas is intravenous IVIT certified and has prescribing rights for bioidentical hormones and injections in Ontario. She's a member of the Ontario Association of Naturopathic Doctors and the Canadian Association of Naturopathic Doctors. She's fluent in English and Greek. And in her free time, Dr. Tsallas loves food, singing, and nature, and she loves to travel, read, and spend time with friends and family. She's the proud mother of two and enjoys sharing experiences about parenting and caring for young children naturally with other mothers. So if you want to talk to Dr. Antonia Tsallas afterwards and to see if she's a good fit for your needs, we'll be sharing a bit of information with all attendees afterwards. And you'll be able to answer and you'll be able to ask and hopefully get answered any questions that you have today in the talk, and also be able to connect later. So there's absolutely a ton of ways to access her knowledge base and care. I'm super excited for this talk. Thank you so much for offering to give it. And I'm really excited because in my practice, I see a lot of folks with chronic pain conditions that are really complicated. So I appreciate you sharing with us and being with us today. Welcome.
Absolutely. Thank you, Julie, and fellow naturopathic doctor. I'm very excited to be here. Thanks Aurum Medicine and Wellness Clinic for having me. So let's dive in. So today's talk is going to be about how to manage pain naturally. It is a topic that is very dear to my heart, coming from some experience myself on different types of pain. I'm hoping that I'll be able to share with you some tips, some things that have worked for me and some things that might work for you. Don't forget that at the end of the talk, there'll be an opportunity to ask some questions. I'm hoping that you'll be able to leave your email address if you wanted to connect, and if there's any other topics and feedback that you can give me to actually talk about some other topics at the same time, and to receive your free handout for this talk. If you'd like to take some notes, you can. Otherwise, you'll be also receiving that handout, which will have the notes for you, so not to worry. Okay, so let's start. So in this starting slide, we will talk about the statistics of pain. We will also address what is pain and how it is transpired into a debilitating and chronic condition, what you can do to manage it, and essentially take some tips home. So why is natural pain so important? Well, here's the statistics. So the statistics I've taken is from Canada, and one of the biggest, most popular drug that is used today is opioids. So the reason I bring this up is because Canada in the recent years has actually become a public health issue because of its opioid use. And if you recall from 2016 to 2018, this was known as our opioid crisis, where there was an increase in hospitalizations and deaths due to poisonings and overdose from medications such as fentanyl being spiked into morphine or heroin, leading to hospitalizations. And in 2018, 1 in 8 Canadians were prescribed opioids. So that's quite a big ratio of individuals. The kicker here is that over 40% of Canadians aged 15 and older will have had reported a use of opioid use in their lifetime. So that is almost 50% of our population has at some point and will at some point be prescribed opioids. So what can we do? And what is the naturopathic and what is the conventional approach and why these medications are being used? So pharmaceutically, what you may or may not have used in the past are your anti-inflammatory medications, which is your NSAIDs. So these include Advil, aspirin, naproxen, Aleve, which is a brand name for naproxen. You've also may have been prescribed antidepressants, such as duloxetine, clonidine, Celebrex, Celexa. And you may have also been prescribed corticosteroids such as prednisone. Opioids may include morphine, codeine, Tylenol with codeine, some of the heavier hitters like fentanyl, and some anticonvulsants you might have also received, gabapentin, commonly also used to treat fibromyalgia, as well as duloxetine. And your monoclonal antibodies, an example is infliximab, which we will get to because this is actually part of what we call hormone therapy and blocking cytokine, pro-inflammatory cytokines. So here's the conventional approach. So there are pros and cons, and this talk isn't completely against the conventional way of medicine. In fact, there are pros to its use, and we will get to that as well. One of the biggest pros is that you get a quick return. Okay, it is, however, a short-term gain, meaning that pharmaceutical medicine cannot actually treat the root cause, but the symptom. So it helps treat the pain, and so therefore you get relief immediately. But unfortunately, this doesn't last very long. And this is why we constantly keep dosing ourselves to reduce the pain, because we feel more comfortable. Regretfully, this leads to a higher risk of side effects and dependency, which therefore can increase your risk of addiction, death, and comorbidities, which we will get to later on in the presentation. So what's the naturopathic approach? So we hope that the pros for this is that you receive fewer side effects. In the long run, it is less expensive. It may be more expensive first and up front, depending on the testing and the type of therapies that we use. But we know that it is less habit forming. Okay, so there's a way to wean off it. There's lack of dependency, but it can actually be used to treat acute and chronic conditions. More importantly, this talk is catered to chronic pain, so very effective in treating that. What's nice about the naturopathic approach is that it actually can be used to support the conventional approach, but it can also be used to be a method of treatment independently of conventional therapy. Overall, it leads to better health improvement, improved quality of life, and a reduction in comorbidities. The effects are actually longer lasting, so you feel better. You may feel better faster and longer, or you may feel better a little bit later, but longer in the long run. And the most important thing is we treat the root cause, not necessarily the symptom. Can we treat the symptom? Yes, we can, and you will find out later on how we can do that. So what is natural pain support? Natural pain support is catered to an individualistic approach. So we cater it to the foundations of improving pain and natural therapies by focusing on reducing discomfort and inflammation, restoring physical mobility and cognitive function, and improving sleep, mood, and energy levels. By doing this, we essentially are treating the root cause of the pain. So what conditions can we treat? Well, a myriad of conditions. In fact, we can treat the physical ailments. We can treat the chronic ailments. We can treat the mental, emotional, and spiritual ailments. So if we were to focus on the physical and local areas of pain, we may be treating back injuries, sciatica, head and neck injuries, tendinitis, rheumatoid arthritis. And for the chronic stuff, we might be treating lupus and Lyme disease and fibromyalgia and myalgia encephalitis. And then for the mental health, we are essentially treating anxiety, depression, almost what may start a pain condition or may just be an additive effect from the experience of pain. So why do we have it? Pain, we have it because our brain tells us we have it. It is a sign and signal that we've received an injury or an uncomfortable stimulus, and it hurts, it bothers us, and we need to do something about it. So what is it exactly? So it's a symptom. It's not necessarily an illness or the condition, but it is a response to the symptom. Sorry, it is a response to the root cause, right? It is an indication that our body needs repairing. That is the most important signal of pain. It is telling us that we need to rest, relax, protect ourselves, and heal. So how do we identify pain as a condition? Well, it has to be diagnosed. And this is where most of the work comes from you as clients or patients to tell us exactly what the pain is for you. So as naturopathic doctors, we spend a lot of time with our clients because we need the details in the description. Because as you describe the type of pain, you're essentially telling us whether it's musculoskeletal, whether it's bone, whether it's neurological. And from that, we can deduce what the diagnosis is, what the type of pain is. There are different types of locations for that as well, because some of it can be directly on the area, like you've received a cut, and so it's a somatic pain. And just underneath the soft tissue, you have some irritability and pain. Or you experience some visceral pain, which is pain that is experienced in the internal organs. Or referral pain, which my best description for that sometimes is having a heart attack. And you have heart pain, but it refers to either your jaw or your back. And these are the kinds of, this is why description is so important, so we can actually decide what the diagnosis is. We support that with past medical history, and then we can do some physical exams. So what is actually going on during pain? So pain is in 4 stages, and it's based on the signals that you experience. So the first is you injure yourself, and so the pain is transformed into a nerve impulse. This nerve impulse is communicated to the brain through transmission, and then we perceive it. Sometimes subjectively, sometimes not, but actually from the release of hormones or impulses or cytokines and precursors that send us information on what pain is. Then our body, and this is the neat thing about body, is that it has the ability to modulate pain. So if we actually need our body to heighten the sense of pain, it will do that. It will do that through communication processes, but it will also reduce pain. And that's why supporting our body's physiological processes is quite important when it comes to pain. So how do we identify it? We identify it, as we were explaining, through your descriptions of pain, but also from the symptoms. And there's more to just pain than the word pain. You can have some swelling, you can have increased heart rate, increased blood pressure, your breathing increases as well. You might get a little more irritable, you might generate a fever, high heat, vomiting, nausea. And once we've identified that, then we generate responses to pain. And so this has to do with the activation of the nervous system. And in this case, the peripheral nervous system. Part of that peripheral nervous system is the involuntary response of the symptomatic nervous system. This is the one that is responsible for your fight and flight response. So when you're in fear or in acute pain or an emergent condition, your body needs to react to actually cope to the pain. So you stimulate brain cells, and these brain cells release endorphins, neurotransmitters such as serotonin, norepinephrine, epinephrine into the spinal cord. This then leads to an increased circulation and an increase of oxygen, which may lead to faster heart rate, higher blood pressure, increased respiration. But the interesting thing too is that your digestive tract actually naturally inhibits itself. And this is what may lead to nausea and vomiting, inability to hold your stool or your urine. As bad as it sounds, it's actually your coping mechanism. And so another response is the link or the connection with the hormone system or the endocrine system. So it's the link with the hypothalamus in the brain that signals to the pituitary in the brain that then signals to your adrenals, which are glands that are attached to your kidneys, okay? And this is where you get the release of cortisol, epinephrine, norepinephrine, growth factor, and cytokines. The immune system is also stimulated during pain because this is what leads to repair. So we have to have an intact immune system for pain to be reduced. And we do that with a signal of damage that releases a set of cells, our immune cells like macrophages, that send signals to pro-inflammatory cytokines and anti-inflammatory cytokines to either amplify pain or inhibit pain. And so we'll get to that next, what the role of the hormones are. So the neat thing about pain is that it stimulates the production and the release of these hormones. So there's more hormones, but I thought I'd talk about the top three here. So from the hormone release, this can actually occur in your adrenals. You can actually get hormones released from your pituitary glands, your gonads, so your sex hormones, your thyroid as well, and your pituitary and cytokines, if you consider them an actual hormone. So when cortisol it's our stress hormone. So when pain occurs, we get into a stress mode. Cortisol is actually released to help us cope with that pain. So what it does is it helps reduce the pain and inflammation in the body by reducing inflammation and inhibiting the prostaglandins, which can be the pro-inflammatory cytokines, and it mobilizes glucose and energy so you get that fight or flight response. Okay, we'll talk about in the next slide why cortisol can't be perfect the whole time and why chronic pain actually inhibits the effect of cortisol to work in your favor. So right now, in an acute situation, cortisol works in your favor. The same thing happens with growth hormone. So it is essential to bone development and tissue growth, okay? It helps to reduce pain and muscle weakness, and it's generally signaled from the pituitary gland. The cytokines, which are an interesting group of immune markers, is that they are essential for healing. They are responsible for the inflammatory and anti-inflammatory signals. So they actually lead to healing, and they are responsible for modulating the pain. So what? So what happens? So what happens when cortisol doesn't do its job? Okay. So if cortisol is on hyperdrive, so you've received chronic pain constantly, your pain is not decreasing, it's just keeps releasing cortisol, cortisol, cortisol. Eventually what happens is it essentially reaches its saturation max. So it's not able to perform the way you need it to. So it stops its overproduction. The receptors that are on the muscles actually get saturated. And so cortisol can't bind anymore. And so you actually just have cortisol floating in your bloodstream, but the pain can't be reduced because it's at its max. And so that leads to pain. We find that with growth hormone, when that's actually depleted or deficient, we see that in patients of fibromyalgia. Okay, so growth hormone is not able to increase glucose production and lead you to that energy where you can actually go and not feel pain anymore. And the same thing goes with the cytokines. The pro-inflammatory cytokines can actually amplify pain. So why that's important is because then it can't be modulated with the anti-inflammatory cytokines to reduce that pain for you. So you get pain, low immunity, fatigue, muscle weakness, increased inflammation, cognitive repair, decreased quality of life. So what happens when we ignore it? So this is quite important because if we ignore these signs that pain is happening and we constantly get a chronic experience of it, we need to do things to actually decrease it. So we tend to eat more. We tend to have carbohydrates because eating sugars can acutely decrease the pain for us, but in the long run leads to weight gain. Okay, same thing goes with cortisol. Elevated levels of cortisol can actually increase weight gain because essentially with that can then lead to diabetes, which because from the more fat that we consume and sugar we consume leads to heart disease. Osteoporosis is an important one because the inflammation that increases in your body essentially creates an acidic environment. So you get the release of your micro and macronutrients from your bone and tissue to neutralize that in the blood and therefore lead to bone loss. Then you're not feeling great about yourself. You're down, you're thinking negatively, and so you feel depressed and anxious. Your immunity is on hyperdrive because you keep activating those cytokines and those macrophages to actually try and reduce the pain. But because of that, then your immune system can't actually function properly to fight an infection or anything else. And so it leads to a lower quality of life. So there are some good news about pain, and that's what I was trying to explain in my talk, is that pain is the signal. We need it. It's only a problem when it becomes chronic and we haven't dealt with it. So it is a clear sign that our body needs protection and healing. We need to balance and repair our body to correct the problem. And then it forces us to actually do what we're supposed to do, which is recover and heal. So what can you do? How can you treat yourself? So one of my favorite things, and one of the number one things that should be done, is laboratory testing. It's always better to test than to guess. But a lot of times when it comes to pain, it's not that we don't know what's happening. It's that we don't know what part of the body is not working physiologically efficient. And so, as mentioned, these hormones are very important in modulating your pain. So understanding the levels of these hormones are very important in understanding whether pain can be reduced or not. So running a dried urine test can actually allow us to test your sex hormones, your cortisols, and your metabolites. We can then deduce whether we need to lower your estrogens, progesterones, testosterones, or raise them, Because in fact, as mentioned before, when there's a heightened sense of pain, these hormones are actually depleted. And so we may actually need to support their production. Another thing with pain is the digestive system. So we believe that the gut is a second brain. Okay, the immune system is what functions through your intestinal tract. And as mentioned, the immune system is important in modulating pain. So when the immune system has either been affected by parasites or bacteria or fungi, or even just damage from food sensitivities, it leads to a leaky gut. And that term of gut hyperpermeability means that food particles or immune responses are seeping through the gut and going into the bloodstream and then generating an immune response. And so with GI mapping, we can actually study what potentially what infections may be there, what parasites may be there, what bacteria may be there, and essentially learn what immune markers and other markers that we need to settle are important to do. The other one of the most important, probably common lab tests that I do is nutritional testing. And this is key when it comes to chronic pain and understanding the physiology of the body. So this is the organic acids test. Organic acids test is another urine test. And this essentially studies the actual energy production, neurotransmitters, vitamins, metabolites that are excreted from your body. Why these are important is because they are cofactors for the actual function of the Krebs cycle. They are cofactors for the production and elimination of oxidative stress. And if these are not at the levels they should be, then these could be responsible for why you are feeling pain. So the most optimal way of doing this is to test these results in either urine, blood, saliva, or the stool. Okay. So what are our goals in natural treatment? So short term, yes, we want to treat the symptom. We can do that. We can treat the symptom if that means that it leads you to a more comfortable state. But ultimately, we are trying to get to the root cause. And that is the long-term goal. Okay. Once we actually treat the underlying condition, we can therefore improve the experience of pain. And we do this with many naturopathic modalities, such as nutrition, lifestyle counseling, botanical medicine, acupuncture, cupping, homeopathy, intravenous therapy, and actual body work as well. So the fundamentals of how we do this. Pain can be significantly reduced with just eating the right diet. I know how hard this can be for most of us because that requires us to make change. But change can be good. And my biggest message here is to eat real food. If food is not perishable, if food is not recognizable, if it was something that your parents never gave you, then don't eat it. You need to be able to eat what is fresh and grown from the ground. Organic is expensive, I understand that. So that's why I say whenever possible, eat organic. And the reason for that is to eliminate the exposure to pesticides and toxins. When I mean whole food, I mean that it is whole, that it doesn't come from a box, that it doesn't come from a bag, that you've grown it yourself, okay? So how do you do this? The basics. Cook for yourself, okay? That doesn't mean you can't go to a restaurant sometimes, and it doesn't mean that you can't find support with some of these meal boxes, okay? Because I will identify which foods can lead to increased pain and inflammation and which ones don't. But if you can cook for yourself, that is the best way to go. And in order to do that, you might need to meal prep. The most effective way of improving your pain and nutrition is simple food choices. So a fruit and a nut, or a vegetable and some hummus, some protein, so legume, or maybe some salmon and some broccoli. It's not that you can't have grains at all or carbohydrate at all. It's that you want to have ones that are certain types of grains and certain type of carbohydrates, such as your vegetables, okay? You must eat a minimum of 3 meals a day. I know how hard this is when you're going through pain, but also smaller meals more regularly can be quite beneficial, and that might lead to 6 meals a day with 1 to 2 snacks. So let's do the foods to avoid first, and then we'll talk about the foods to add, okay? The reason I say this is because it's not about just eliminating, but it's about identifying to you why these foods are so problematic, okay? Alcohol can lead to increased inflammation, dehydration, high sugar consumption, leaky gut, and now you've used your liver to metabolize the alcohol, that it could actually be used to generate more hormones, metabolize cholesterol, basically detox your body of any toxins that you might be receiving. Same thing goes for caffeine or coffee. It can be dehydrating. It can increase your stomach acid, which therefore lowers your pH and increases acidity and inflammation in the body. This then can damage your intestinal tissue and can lead to a leaky gut. It suppresses your appetite and it disrupts sleep. Red meat is one as well because it's high in fat as well and inflammation because it is a red meat. Dairy does the same, increases inflammation as well because it is not very well digested or absorbed. A lot of times it contains hormones that may affect your body. It usually disrupts cognitive functions and leads to inflammation. It can permeate the gut and essentially contains a lot of sugar. And gluten is very similar in itself as well, in that it can increase the inflammation, weight gain, permeability of the gut. These basically trigger the immune system to go on hyperdrive. So you want to avoid refined sugars and any processed food. The list can go longer, but I'd like to focus on the big groups here, not all the little ones. Sometimes some people have sensitivities to either soy, peanuts, citrus fruits, or nightshades. These nightshade vegetables, these can also be inflammatory. But in the grand scheme of things, I would suggest that these are bigger than some of the other ones. So what can you consume? And there's quite a bit. The thing is that you want to make sure you have adequate amounts of protein. In this case, I always suggest to stick with white meats, okay? White meats are very high in protein. They're high in amino acids, and you can find these at an organic level as well if you're worried about the antibiotics and the hormones. So chicken, turkey, fish. You want to make sure you're eating fresh fruit and veggies. At least 1 to 2 servings of fruit a day. If you can do 5, great. If you're watching your weight, you might want to cut it down. Vegetables, a minimum of 8 to 11 servings. Nuts and seeds, which essentially provide you with healthy fats, you want to have 1 to 2 servings a day. Healthy fats such as your cooking oils, so your coconut oil, your avocado, your olive oil. You want to make sure you're having adequate amounts of water. And some herbs and spices that you could use in your cooking that actually have anti-inflammatory effects are ginger and turmeric. It's not that you can't have dairy and gluten indefinitely, but substitute it. You'd be surprised how tasty it can be if you have dairy-free options like coconut milk, almond milk, coconut oil, hemp seed oil, hemp seed milk, chia seed. You can also do rice milk, So there's multiple kinds of milks. Same thing goes with yogurts. You can find those as well. Cheeses and gluten-free grains, such as quinoa, rice, amaranth, buckwheat. These are all gluten-free options for you. So hydration. Why drinking water is so important? Because it regulates your blood sugar, reduces pain, hydrates your cells, provides you with energy, regulates any underlying condition, decreases dehydration, decreases cravings, late night cravings, a big one with hydration. So do you ever ask yourself how much you actually need to consume? Well, we always say as naturopathic doctors, you may want to shoot for 2 to 3 liters, but that might not actually be accurate for you, because a general rule of thumb is to actually take your complete body weight and divide it by 2. Half of that will be what you need to consume in ounces for minimal cell function. I mean, our body contains up to 60% water. And so we need to replenish that plus some. So there is a conversion factor into liters, but generally speaking, on average, we might need 2.5 to 3.5 liters of water. So it's quite a bit to be above the minimal requirement. Exercise. Very counterintuitive, I understand, when it comes to pain. But here's the thing. You don't have to kill yourself when it comes to exercise. I'm not talking about moderate to intense exercise. I'm talking about pacing for what your body needs. So aim for low impact exercise. This way it's safe on the joints and more manageable. A nice rule of thumb would be to try and aim for 10 minutes of walking a day, if that is a routine that you can consistently set out for yourself. And if you're ready and prepared for the next step, then you times that by 10% and you add that 1 minute extra each and every time. So once you've done that for yourself, then you can actually help support your joints, strengthen your muscles, relax them, increase blood circulation, increase energy supply, support sleep and cognitive function. There are certain exercises that you might find beneficial, like aqua fit or tai chi or recovery yoga or restorative yoga, chair yoga, Pilates. These types of exercises are quite low impact for you. So here's the other foundation that needs to be set when it comes to managing pain is sleep. Sleep is probably the most important thing you can do to reduce pain, but is probably the most challenging, because when you're in pain, sleep usually goes out the window. And it's not for a lack of trying, because you definitely want that sleep to be improved, but it's because pain inhibits those functions. So we want to be able to restore the cognitive function. We want you to be able to reduce blood pressure, essentially promote healing. We want you to balance your hormones so they can work in the favor of reducing pain. A good night's sleep improves cognitive function, memory, and mood. It actually supports metabolism and learning. And so what tips can you do to try and help that? Well, some of the best sleep hygiene techniques is to actually stick to a schedule. This could be whatever routine that you're used to, but to aim for at least 7 to 8 hours of sleep. If you're not happy with the routine that you're used to, let's assume you go to bed super late and you're going to bed at 1 o'clock in the morning, and then you have interrupted sleep, then you might want to use the sleep restriction technique, where you try to stick to the same time of sleep every week for 7 days, and then reach the goal to which you want to go to bed at by increasing the time you go to bed by 15 minutes. So how to explain that better? So assume you go to bed at midnight. So every day for a week, you go to bed at midnight. And then the following week, you go to bed at 11:45. And for that week, you go to bed at 11:45. The following week, you go to bed at 11:30. So you're shortening the increments by half an hour to assume to get to the goal that you want, which may be 10 p.m. you want to be in sleep. You want to avoid caffeine and alcohol because these stimulants can keep you up at night. You want to avoid screen time because these screens emit a blue light that actually inhibits your secretion of melatonin. You may want to establish a nice, cleanly sleep routine that involves an Epsom salt bath or reading a book or drinking a cup of tea. And the most important thing is to leave sleep in your room to sleep. So in other words, make sure the room is organized and not cluttered. Make sure you don't have your phone beside your bed to emit the Wi-Fi signals. Make sure that the temperature is down to a most comfortable level for you, that you wear loose clothing, and that you sleep in the dark. So other forms of effects that pain can have or can be triggered by is stress. So in the next slide, we'll talk about self-care. So stress produces cortisol, which can be great in certain situations to regulate pain. But in chronic situations, when stress is constantly heightened, your cortisol is at its max and it's not going to help reduce the pain. So you get elevations in cortisol, which then can lead to depression, anxiety, digestive issues, and headaches, heart disease, etc. So what can you do to actually reduce the stress? Self-care tips. Some of the most important ones to me are making time to do the things that bring you joy. Okay? If you don't know what they are, then journal. That's another form of self-care. Get to know yourself. Set boundaries and pace yourself. Okay? Life is different now for you. It's not as if you were able to do even though you were able to do those things before, you may not be able to do them now, but that's okay. And I don't want you to focus on that. You need to focus on pacing yourself and establishing a new routine that makes you feel better. So that means you also have to be okay with saying no. You can't say yes to everything all the time. Your body functions differently. Essentially, if you don't pace yourself, then you're going to go back to square one because your body's going to crash. And then you're going to spend 3 to 4 days trying to recover again. Whereas if you constantly pace yourself at doing the same routine each and every time, then you may not ever crash because you've established something that fits for you perfectly. Breathing exercises are probably one of the most important things for me. So one of the techniques I put here was the 4, 7, and 8. So you breathe in through your nose for 4, you hold it for 7, and you breathe out your mouth for 8. Meditation practices, 5 to 10 minutes a day. Maybe taking a nice warm bath and spending time with friends. Regretfully, the difficulty here is the spontaneity. You may not be able to be spontaneous anymore. You may actually need to set yourself a pace and a record that works well for you, okay? So what can we do in terms of naturopathic supplements? Well, there are certain supplements that can actually be quite helpful when it comes to pain. That being magnesium, which was one of the most common pain supporting supplements. Most of us are generally deficient in magnesium. We find magnesium in vegetables, grains, nuts, and seeds. But magnesium is really important because it helps reduce the pain and fatigue. You find it in bone, soft tissue, and it is a cofactor for over 300 enzymatic pathways. So if you don't have enough magnesium, you can imagine that you're not able to actually generate enough energy to support your muscle function and reduce pain. So physiologically, it can support neurological activity, cardiovascular health, and electrical properties of your cell membranes. It dilates blood vessels and it allows you to function better. Another one of my favorite supplements is vitamin B12. Vitamin B12 is generally found in meat, some legumes and nuts, but it is important for improving pain and energy. It can come in 3 forms. The most active form is methylcobalamin. The body produces that, but it also is the active form. You can also have hydroxycobalamin, but it needs to be converted to the methyl form to be active. And sometimes you receive cyanocobalamin, which is actually a synthetic form of vitamin B12, which is why as naturopaths, we always give the active natural form, which is the methyl. So you don't necessarily have to convert it yourself. And by doing this, we can actually treat neurological symptoms. We can improve brain clarity. We can reduce pain. We can reduce neurological symptoms. We can improve mood and energy. And it can be administered through injection, which is a better way of absorbing it because it goes directly into the bloodstream. The other great supplement is coenzyme Q10. Coenzyme Q10 is the most important antioxidant for your muscle function because it leads to the synthesis of ATP, which is your body's storage of energy. And this is important in pain reduction. When your body's functioning and generating energy, your pain decreases. So it has antioxidant properties. So IV therapy. So we take these vitamins and we can actually inject them directly into the bloodstream. Why this is so important is because if you're less compliant in taking oral supplements and you prefer to actually take them directly into the bloodstream, we can give these vitamins at a higher concentration and they can be absorbed better by bypassing the metabolism in the liver and go directly into the bloodstream. So you can actually feel better, faster, and for longer because the concentrations are higher and you're not treated with IV therapy every day, but maybe 1 to 2 to 3 times a week at higher concentrations. And so the frequency, the size of the bag, the number of nutrients that are in there will depend on you. It will depend on what we prescribe it for. So we could put vitamins in there, we could put amino acids, we could put minerals, and some of those include vitamin C, vitamin B, magnesium, calcium, selenium, zinc, glutathione, and some amino acids, essentially helping reduce pain. We can also use botanical medicine, which are the herb form. So essentially the natural form of drugs before they are synthesized. So they will contain other active ingredients in them because they are not purified. Okay, so essentially they can be used to treat different parts of different systems in the body, and we can improve pain, sleep, and stress. And we can create a combination of these through a tincture liquid form, which will contain some alcohol because of the herbs need to be extracted, or the active ingredients need to be extracted. So we put them in alcohol, but you can also take them in tablet form if you can't stomach the taste of them. Some of these herbs include turmeric, boswellia, withania, and valerian. And the key is that these are all anti-inflammatory. These all contain anti-inflammatory properties. They can also be used to treat gut health as well as physical, mental, and emotional pain, improve sleep, and reduce inflammation. Withania is very commonly used to actually modulate your cortisol levels. and then valerian is also really important for improving sleep as well. The caution here is that because they are a natural form of a drug per se, they will have potential interactions with some of the medications that you're taking, because they have very similar properties to the medications that you are taking, because those medications are synthesized from these herbs. Okay. So we can also use Chinese medicine, which is body work. So direct local activity can be done here, but also we can do systemic changes as well, which is full body acupuncture, not just acupuncture in the location of the pain. And by doing this, we are essentially rebalancing your yin and yang. So yin being nurturing, slow, and restful state, whereas your yang being quite aggressive, fast, and energy expelling. So when it comes to chronic pain, this usually depletes your yin, okay? And then it elevates your yang, which leads to an imbalance. And so to be nurturative, we need to actually replenish your yin, restore it so that you can go back to balance. So if we can actually do that, then acupuncture can be a quite effective method of treatment for improving pain symptoms, improving sleep, mental clarity, mood, etc. Another one of my favorite body work mechanisms is cupping. So I'm not sure if you've heard of cupping before, but cupping is using negative pressure from the attachment of cups directly onto the tissue and creating a vacuum that draws up the tissue. It leads to a separation of any adhesions or sticking of scar tissue or debris under the tissue, and allows blood to recirculate and flow underneath to generate repair and healing and recovery. Cups are usually not put on for more than 3 minutes at a time in a stagnant position. We can move the cups around to improve circulation, but we essentially don't want you to bruise when it comes to cupping. Cups can leave marks. Yes, that is true, because we want to draw up the stagnant old tissue that is and blood that has been sitting there and not actually helping in repair. So these marks are natural, but they should dissipate over some time. They should not be painful, and they should not lead to swelling or tissue damage. We can then release the cups, move them to another place, and set them again. It's actually quite therapeutic, and we can adjust the pressure so that it's not overly stimulating. The great thing about cupping too is we can do it on the face. Obviously, we don't keep the cups on the face, but by doing this, we are able to actually improve any facial scar tissue, provide you with cosmetic facelift to make it more plump if we need to. And these cups are not left stagnant. They're always moving, and there's generally a carrier oil that is applied to the face as well. So as a final technique that we can use to reduce pain, it's the idea of detoxification. I was hesitant to put it here because I often find with my pain clients is that detoxification can worsen symptoms at times, because what happens is your body is used to this homeostasis, or this balance of what your body has experienced for the past 20 years or so. And now I'm asking you to eliminate these toxins. And as a symptom picture, you might experience more pain, or you might actually get headaches. But by doing this, this is a sign that you actually had polluted yourself, not on purpose with toxins, but through environmental exposure that you weren't aware of, from food intake that you weren't aware of, from medication use as well. And so we need to rid ourselves from these chemical toxins to improve our ability to heal. The organs that are involved in this is generally the liver, kidneys, and the skin. So what is the process? Well, because the major organ that's responsible for detoxification is your liver, it actually goes through 2 phases. And if you can see here, these are the nutrients that are needed for this. And while we supplement with this, it's important because we're essentially supporting your detoxification pathways. So in the first phase, you're actually trying to change your fat-soluble toxins into water-soluble toxins so that they can be excreted out the urine. And you do this by oxidation, reduction, hydrolysis, and hydration. You use these cofactors or nutrients to help these enzymatic pathways that lead to phase 2, where you actually make the toxins into water soluble with these amino acids, as well as vitamins and folic acid, and you excrete them in the urine. So how do you actually detox? You support the body. You can support the body through nutrients, such as eating real organic food, eliminating gluten, grains, dairy, soy, peanut. So the list is quite large when it comes to this, and using a lot of water. You can avoid your cosmetic products as well as your household products. You can switch these up, make sure they're paraben-free, fragrant-free, free of petroleum. And there's a lot of companies that do that. I use Eminence, for example, for my facial cosmetic stuff. I use a lot of doTERRA essential oils as well. And you can also use hydrotherapy. So use of saunas, contrast showers, castor oil packs, and dry brushing. And these are used to kind of detox or push the body into a detox state, okay, where we can change the water temperatures by having a shower with hot and cold. We can apply castor oil directly onto the liver to help support that pathway. And we can use dry brushing, which is a method of manual detoxification so that it can actually filter toxins through the lymphatic system. So in conclusion, the best possible things you can do to support pain is to eat a nutritious diet, to get adequate amounts of sleep, exercise, pace yourself, change the way you think. I know this is hard, but try to think more positively. Factor in self-care, which will help support your positive thinking. Replete your deficient nutrients. Eliminate environmental exposure if you can. Excuse this spelling mistake here. And then surround yourself with supportive people. You will succeed with the love and care of others and those that support you. And when you do that, you can achieve anything. So these are my references. If you have any more questions regarding that, please feel free to contact me. And I thank you very much, and I welcome questions at this time. Again, feel free to leave your email if you need to, as well as we will be providing you with some free handout for you to have these notes in the future. Does anyone have any questions?
Thanks, everyone. Thanks so much, Dr. Antonia. That was amazing. I found it super helpful. I'm going to ask that if folks have questions, they can put them in the group chat and everyone can read them. Wow, I have a ton of questions, but why don't we kick it off? We've got one here from someone from Sen. So what do you think of CBD?
Okay, so CBD oils. So they can be quite therapeutic, actually, as long as it doesn't contain the THC. The CBD is actually quite effective in reducing pain. So I have seen a lot of my clients come in and they have been prescribed CBD oil. Luckily, cannabis is quite natural herb. And so we can use that to support the other natural therapies and be careful not to have drug interactions. But the bottom line is if it is effective and safe for you to use, then you can use it. A lot of my clients use it in edibles and they feel much better. This helps support sleep. This helps support pain, and it can be quite effective.
Thanks so much. Yeah, I mean, we're learning so much more and more about the cannabinoid system. So I feel like there could be so many talks about about cannabis and pain in particular. But it's good to know that it's not interactive. It can be used safely and not interact with any of the approaches if we know about it. That's great. I have another question here. Would this technique be effective for fibro symptoms? So maybe you can give us a little more context about fibro.
Sure. And which technique are you thinking of? Do you think, are you naturopathic in general?
I'm not sure. I think that's what this person is asking. Maybe they can clarify, but I would say like this whole method or approach.
Yes, yes. So, well, this is great. Oh, naturopathic in general. Okay, I see that. Thank you, Catherine. Yes. Bottom line is all of these modalities are very effective in providing support for fibromyalgia symptoms, but also treating the root of fibromyalgia. So the interesting thing about fibro is it's very, it is not unidirectional, it is multiple. Okay, so you'll often see multiple factors coming into play. Generally, I do see diabetes or high cholesterol or something else. And so all of these kind of fit into one. And so when it comes to treating fibromyalgia, the great thing is we're not treating the symptom, we're treating the root cause. And one of the most effective therapies here is doing the lab tests to understand why the Krebs cycle is being inhibited, because generally with fibro, it has to do with the lack of production of energy that can lead to the pain. We don't know 100% the cause or the mechanisms that are responsible for causing fibromyalgia, but we do know that we do see a depletion in nutrients and dysfunction in some of the physiological processes. So we can actually support these physiological processes by understanding what is depleted. We can also treat the body physically with some of the body work, and we can improve the general pain reduction in that process. So very important for IV therapy when it comes to fibromyalgia.
Yeah, no, I love the way that you explained like the functional aspect of what can be causing pain and contributing to it. It is a big question with fibromyalgia. I see a lot of patients with it that and functional medicine testing is really helpful. You're right.
Yeah,
so,
yeah, and I'm glad.
Cycle I love.
Absolutely, and I'm glad to hear that, Sendrin. I understand you have it, and I'm glad to see that you're having a significant improvement with some of the CBD oil as well. So that's really nice.
Yeah, a lot of this is. I found this really helpful. I want to make sure that folks feel like their questions can be answered. So what we'll do is, if there are any further questions outside of this forum, you're going to be sending out a handout. So everyone just remember, Dr. Tsallas is going to send out the handout. I'm going to email you individually with some of the resources and with a link to the recording of this talk in case you wanted to go back and review anything. I found it, I'm certainly going to be going back. There were a lot of things that, from a fundamental physiological perspective, it really is going to support some of the ways in which we work. So I hope folks found it helpful. There was obviously a lot of interest and a lot of attendance, so thank you for participating. And thanks so much, Dr. Antonia. Really appreciate you taking the time. I loved it, and can't wait to see your resource guide and your handout as well.
Absolutely, you're welcome. And if anyone wants to chat with me for 15 minutes, I'd be happy to see you for a nice complimentary consult, and we can chat a little bit about, you know, what you've been up to and what may or may not need some improvements as well.
Yeah, so a personal consult is great.
Yeah.
I love the 15-minute. See if it's a good fit. If you have questions for Dr. Tsallas about your own condition, why not? You know, just reach out, check in, ask your questions, and you'll be able to see if if there's support there that can be offered. So thank you so much. Let's have everyone have a great day. And oh, why don't I'll add your email address here in the chat at Aurum Medicine. And there's your email. And then I'll also send a link in the chat group and in the email where you can book those 15-minute consults. And you can book it live online, or you can call our office. Okay? Wonderful. Thanks,
Fantastic.
everyone. Have a great rest of the day. Thanks so much, Dr. Antonia.
Thank you, everyone, and we'll send some information for you as well. Okay.
Yeah, perfect. Thanks for sending your emails. Take care.
Bye-bye.